Now on to the actual debate. It's important for everyone to know that academic competitive debate has continued, and it's continued virtually during COVID. In the upcoming debate, you will see exactly how this works. Bright students working with their team, researching, writing their own arguments, and making their case, but doing it online. So today, advocating for the affirmative side, the best way to solve health inequities is a single-payer health plan, and this is representing the east side of the river, is Chikamso Chijioke of Como Park High School in St. Paul, and then Marshall Steele of Central High School, also in St. Paul. And I'm not saying I'm biased in this debate towards the affirmative, but two of my three sons were Central High debaters, so go Central. On the negative side, arguing that a better approach is a two-tiered health plan, Michael O'Neill of Roseville High School and Harriet Lindner of Washburn High School in Minneapolis. And now to the debate.
Hello, hello. My name is Chikamso, and this is my partner Marshall over there on the screen. And what I'm about to say is probably so obvious it goes without saying, but I'm going to say it anyways. There are lots of problems with our current healthcare system. That is why today my partner and I will be arguing that the United States should adopt a single-payer healthcare model. This single-payer model will be everyone paying into a government healthcare system, which then administers payment for everyone's healthcare costs. We also wanted to make this debate a little easier for our opponents, so they won't be arguing for the status quo, but instead for a two-tiered system. Therefore, we will be arguing the strengths of a single-payer system. To do this, I want to talk about three areas where single-payer healthcare performs better than a two-tier system: cost, access, and quality. As of now, our healthcare system is not only not cost-effective, it's just plain ineffective. Many people struggle to pay extreme costs for healthcare, especially with the devastating impact of COVID-19. CNBC found that 66%, a full 2/3 of all personal bankruptcies were directly tied to a medical emergency. A single-payer healthcare system would resolve these costs to individuals. It would also drive down overall costs because the government's controlling share in the market would allow it to bargain from a stronger position with companies. Sounds unrealistic? Well, here's a reality check. For the same vial of insulin, you would pay $300 in the US, but only $30 in Canada. Another important aspect to look at is that of access. Even if we ignore the financial horrors of our current system, a single-payer system would still grant more people more access to healthcare. According to the Commonwealth Fund's Biennial Health Insurance Survey, as of 2018, 29% of all US adults are under or uninsured. That is a whole lot of people. Numerous studies from around the world, like those from the OECD Health Equity Research Group, reaffirm that nations with single-payer systems have more equitable distribution of primary care visits from across income groups. Our current system also makes healthcare racially inequitable. Many studies, like that from the Commonwealth Fund, the CDC, and the New England Journal of Medicine, document how access to care is worse for minority populations by most measures, even though minority populations are more likely to have health issues. That doesn't add up. Single-payer will increase access to healthcare for everyone. At this point, you must all be thinking, if people can't afford their healthcare and they don't have access to it, then at least it must be high quality, right? Well, not quite. Certainly, the US has some of the best healthcare systems in the world, including Minnesota's own Mayo system. But due to societal factors discussed above, elite medical systems are more likely to see a Saudi prince than they are to see someone from North Minneapolis. There are major barriers to quality care that would be resolved by a single-payer system. Cost of visits, restrictions by provider network, and restrictions by medical procedures would all be eliminated. With the government paying medical bills, private providers would have more incentive to provide high-quality care to everyone, as there would be no worries about defaulting on bills. A two-tiered system still relies on these inaccessible payment-first systems. In conclusion, based on the 3 points above, it should be clear that our current system is failing those who are most in need, and that the optimal solution is to adopt a single-payer system. Thank you for your time and attention. My partner will now answer your cross-examination questions.
So, Marshall, you and Chikamso, would you defend that healthcare is a right?
Yeah, we would.
Right, and you said that we need the U.S. government. What's their track record with rights?
The U.S. government's track record isn't perfect, but it's better than corporations, at least. Both are very flawed, but the government is at least accountable to the public whereas corporations aren't accountable to anyone except their shareholders to make a profit. So they have no motivation to actually uphold rights, which is what we see in the status quo.
Okay, and we mentioned the SQUO. So would you and Chikamso defend SQUO is discriminatory towards people of color in terms of healthcare?
Yeah.
Okay, and you would also defend, or not defend, but you also agree that the government has been discriminatory towards people of color with rights.
Yeah.
Right, but has it been a legal right given to everyone as like
healthcare in the status quo? No, healthcare is not a right in the U.S. in the status quo.
But it'll just happen if you guys win, right?
Yeah, that's the entire premise of our plan, is that healthcare becomes a right that you don't have to pay for. Yeah.
Okay, and then moving on. So how long exactly does this take? How do we go from a discriminatory healthcare system now and a discriminatory U.S. government to an equitable, universalized healthcare? Like, what's the time frame for that?
So I'd say probably you're looking at half a year. The main delay is honestly just like deliberation in Congress. Bills take time to pass. Other than that, it's literally just rearranging funding and distribution of services to be more efficient and equitable.
Okay, so you and Chikamso are saying it take half a year to fix both the discrimination within the United States federal government, as well as the discrimination you point out in the healthcare system now?
I mean, yeah, the main issue is deliberation in Congress.
As well as it takes half a year to deprivatize the entire healthcare system as well?
I mean, yeah, it's just a passing a bill. Everything else is just redistributing funds and services. Like, other than that, it's a pretty simple process.
If helping people of color in the SQUO is so simple as passing a bill, why hasn't it already happened?
Because, as you pointed out, like, the government is discriminatory and healthcare exists to make a profit, and so puts large amounts of money into making sure it doesn't become universalized.
Okay.
That's like a huge lobbying thing.
Okay. That's time.
Hi, my name is Harry and my partner is Michael. Today we'll be arguing that two-tier model of healthcare is the cure to our nation's ills. Everybody knows that healthcare is an expensive necessity, despite the fact that it is a necessity. The way a two-tier system would operate would ensure that everyone would have basic access to routine healthcare with the additional option to purchase healthcare coverage from a private market. To illustrate the superiority of our system, we'll be talking about cost, access, and quality. First, how a two-tier system would reduce the cost. The goal of a two-tier system would make it so the average American does not have to spend 20% of their paycheck on healthcare while still retaining the opportunity to get high-quality coverage for specific needs. Having a two-tier system would eliminate the majority of costs with our current for-profit healthcare system entails, without getting rid of companies' incentives to make the best product at the lowest cost to us. The second tier of the system allows companies to compete with each other, which incentivizes and reduces the costs to a larger market share. This keeps healthcare affordable and sustainable. Most countries have both privately and publicly funded healthcare, and it works well for them, or at least better for them than it does for us. Second, in a two-tier system, not having accessible healthcare would be a thing of the past. You no longer have to stress over wondering how to get healthcare because it can most definitely be accessible to you. In other countries such as the United Kingdom and many parts of Europe, they use a two-tier health system. And on average, their healthcare is more affordable, accessible, and of better quality to its citizens compared to ours. According to Diana Brown, director of the Next System Project, only 20% of healthcare outcomes are attributable to health we receive. The other 80% are due to social determinations, lifestyle choices, and environmental factors. So retaining different access to opportunities in a flexible two-tier system is key to allowing these people to control and access care that the other 80% of healthcare factors. Last is quality. This is where a single-payer model has its real shortcomings. A single-payer model would completely hollow out the competitive healthcare system. As much as it admits is a government monopoly on the payment would drive down the prices drastically, but this also means it would drive down profits. And hey, I also understand that not everyone is a big fan of the private healthcare system. I totally get that. But the big issue is that it's not the government that does the research or invents the best product. It's the companies who compete, and their competition creates better quality care. The US is the most competitive healthcare market, and it's no coincidence that we have the best quality care in the world too. A single-payer healthcare would go backwards at the advantage of price and the disadvantage of health. In conclusion, based on the evidence above, it is clear that a two-tier system is sustainable and the best interest of everyone else, while a single-payer model is unsustainable and one-dimensional. Thank you. My partner and I are now open for cross-examination.
Michael, do you think healthcare is a right? Just yes or no?
Yeah, I do.
Okay. And do you think people should have to pay to exercise their rights? Again, just yes or no?
No.
Okay. And so can you give me one example of corporations upholding the rights of individuals?
Well, first off, it's not necessary. I don't think the problem is with corporations doing it. I think that the government we trust with our lives are, the government that says that they will protect us and uphold our rights is the one we should be focusing on, and not the corporations.
That's fantastic. In the status quo, does the government distribute healthcare, or do corporations do it?
It's a mixture. I mean, obviously there's different forms of health insurance that you can get from private insurers, as well as there are governmental programs.
Okay. So do you think we should trust corporations to uphold the rights of individuals, specifically the right to healthcare?
I think that right now, as it is, the government isn't even doing it. So I don't think that we can even possibly expect corporations to do better than our governmental structure can at the moment,
that's great.
Or has ever done.
That is great. So I guess moving on, will health insurance still be mandatory? If
Health
so,
insurance
what's
is
the point in having two-tiered system?
So health insurance is not mandatory in the world of the negative, if the negative wins this debate, right? It's not mandatory because while we are able to access the same governmental basic care that you provide.
I just want to know if it was necessary or not. So moving on from that, what's the point in having it be two-tiered instead of single payer then? If health insurance isn't mandatory and you don't have to pay for it, why not just do full single payer?
Well, single payer has its faults. Looking at Canada, with the Canada is an example of a single payer state, and they have lots of problems there. So also the fact that the government already sucks with upholding our rights, especially the right to healthcare. And so if you give them all the power of that, if you literally give them the entirety of the power of life and death over the people they aren't respecting at all, it's not going to lead to anything productive. Instead, it's going to make the government a monopoly. It's going to make the government authoritarian over life and death over its citizens, pretty much.
Hi, everyone. My name is Marshall. So first things first, it's obvious that both teams want to provide some level of coverage for everyone, but only the single payer system of the affirmative team provides accessible, zero cost, high quality healthcare for everyone in all parts of their lives. The negative proposal of a two-tiered system will ultimately reflect the two-tiered nature of America. We'll go back to the three legs of the healthcare triangle to prove our argument. First is cost. As my partner laid out in her first speech, a single-payer healthcare system is the most effective system for removing cost barriers, as in there wouldn't be any. In the two-tiered system, advanced healthcare would still cost money. Say you want to get an unnecessary but still recommended CT scan to check for cancer. It's going to cost you. Or you want medication to help with a non-debilitating but still painful headache. That's going to cost you. The problem with a two-tiered system is it doesn't eliminate the cost barrier. It just changes what care is kept behind that cost barrier. Healthcare is a right, and we don't lock our rights behind a paywall. Even if people would be willing to pay, they shouldn't have to, and under our plan, won't have to. And that's exactly what the neg and the status quo, want to reverse. Even if the government doesn't have a perfect track record with holding up rights, corporations will and have done worse. Second is the access issue. Our opponents claim that only 20% of inaccess is due to financial problems, but that's an inaccuracy of statistics. Sure, if you live in a food desert, then you have a barrier to accessible quality food. But why do people live in food deserts? Financial issues. Why don't people have access to transportation that can take them to a farther away grocery store easily? Financial issues. Why are people working two jobs and therefore don't have time to go farther out to get groceries? Financial issues. Reducing financial issues will resolve these access issues. If we get rid of those 66% of bankruptcies caused by healthcare costs that Chikamso talked about, then people can start spending their money on other access-related issues. Only the single-payer model can eliminate these costs to the individual. That would open up access opportunities, and people need money to access healthcare. Finally, on to the quality contention. Our opponents made the argument that a single-payer healthcare system will decrease healthcare innovation. Firstly, this isn't true. While there would be less competition, that doesn't necessarily mean health companies would stop innovating. For example, the US federal government has already funneled $10 billion with a B dollars into finding a vaccine for the coronavirus. But the government has given away the rights to patent it. So there isn't any reason that removing the private money part of healthcare would affect the development of medicine and medical technologies. The government already funds research. We're just making it so they also fund the distribution of the services provided by that research. In conclusion, even if the negative is 100% correct about the fault of single-payer healthcare, that it will decrease quality and innovation, it'd still be far better for everyone to have access to decent healthcare than it is to have a small privileged group be able to access great healthcare. If you want legitimately accessible, high-quality healthcare, you should vote affirmative. Michael, I yield the floor to you for the second negative speech.
Hello, my name is Michael, and I have a lot to say, so I'm just going to get into it. First, with cost, listen, the number one cost in healthcare is not what the affirmative would have you believe. It's not the price of drugs or the administrative overhead, and it's not even the evil medical companies, according that Chikamso and Marshall want to talk about. But according to the Department of Family and Community Medicine at University of California, the number one cost is overuse of the healthcare system. You know what doesn't stop people from overusing the healthcare system? Giving them a blank check for medical care. So sure, it may not directly cost individuals anything, but a single-payer model is going to supercharge the cost of the system, which will have all kinds of downstream effects that decrease both the quality and access of healthcare. This model is completely unsustainable in the long term, and only a two-tiered model can keep these costs in line while still providing access to quality basic medical care. And Marshall, it is not the marginalized, the we that you talk about, that want to pay or even insist upon paying for our rights. What alternative is there? When have our rights ever been respected by the government? Even the conception of what is a right in Western society was built to marginalize. If payment within a two-tiered system brings equity, it's a cost the marginalized would happily pay any day of the week. So moving on to access, here's a word the affirmative doesn't want you to hear: rationing. Given the overuse of our system, we can expect rationing to be fairly severe in the affirmative model. Michael Diamond, professor of public affairs at the University of Missouri-Columbia, agrees. Based on studies done over the last 20 years, he found that patients in countries with a single-payer system, like Canada, are more likely to have their healthcare rationed, leading to both long waits and infrequent access for those in lower-income areas. The negative is the only viable strategy towards creating universalized healthcare in the near future, because we act right now to disempower private insurers and implement key governmental structural change as we go, instead of the affirmative's idea, which is literally just that we will cause a massive shift in society because we won this debate, and that they can solve systemic racism with something as simple as a bill in 6 months. And finally, let's talk about the quality. Healthcare patients are not the same. Each individual is unique and can require vastly different tools and treatments to be helped and hopefully cured. But the affirmative is proposing a single response to 360 million, listen to that, Marshall, million with an M, different people. They assume that what works for 1, 10, 100, or even 1 million can work for everyone. The affirmative wants to help minorities, and that's clear. But a healthcare system that is built off privileging the majority of anything will always create and disempower minorities. Just remember back to Canada's rationing. And under the affirmative's model, the common flu and broken bones become a concern of the past. But what about those with late-stage cancer or a rare genetic disease? We need a plan that can account for individual differences, but at the same time provide for all, something only a two-tiered system can do. The US has the best healthcare in the world, which is driven by market competition. But a single-payer system would put the market into a critical condition and would be a death knell for innovation and quality. In conclusion, it should be clear that a single-payer system is a massive overstep, and only a two-tier system would get us where we need to be without overcorrecting our healthcare system or throwing the market into a crisis. Thank you.
So it seems the negative has made a lot of misleading characterizations of both the single-payer system and the two-tier system. First, they bring up the contention that a single-payer system disincentivizes market competition and quality. This isn't exactly the case. The private sector would still thrive. Regular citizens just wouldn't have to pay so much from care for it. It's not like the single-payer system would get rid of the research and innovation that the private sector partakes in, only that the government would pay for the care for the people, only that the government would pay for the care that people choose. In fact, single-payer would actually increase competition because more of the private sector would be available to more people. due to the elimination of the cost barrier and provider network restrictions. Furthermore, even if the wait times would increase under single payer, like the negative claim, at least people would be able to get the care they needed in the first place, instead of suffering some horrible outcome. And even if all the negatives arguments were true, you would still have to vote for the affirmative team at the end of this debate. That's because healthcare isn't about abstract concepts like the system or the market. It's about the individuals that healthcare serves. When we look at how the two plans impact individuals, it's clear to see that the affirmative is miles ahead. That's because this whole debate really comes down to the question of cost to the individual. Cost is a sliding scale. More unique and rare treatments are at the far end, and basic care is at the near end. But here's the thing. Health insurance isn't like car insurance. People don't choose to have or not have cancer. People don't choose the pre-existing conditions. People who are most disenfranchised by the healthcare system aren't there because they choose coverage A over coverage B. They're disenfranchised because they simply cannot afford the care they need. There may be all kinds of incidental reasons, but at the heart of this debate is the fact that people under our current model and the two-term system will still be left to foot insurmountable medical bills. And those people will largely be low-income persons and people of color. And this is where the health inequality comes from. So it doesn't matter how good the best quality care is or how readily accessible it is if people simply cannot pay for it. Only a single-payer system resolves these problems. And with a single-payer system, we can streamline the payment process, ensure coverage for everyone, and drive down overall cost of care. The two-tier system cannot do that.
Well, here we are, the final speech of this debate. So what have we learned? Well, single payer will probably resolve the cost to individuals, but in the process, they'll explode the cost to the system. This will lead to inaccess and low quality care, especially for those who already face access to quality and low coverage. As Michael so divinely explained in his speech, the main cost to the healthcare system is the overuse of the system. In a single payer system, the government would persuade incentives to reduce the costs. There are several ways this could happen. One is rationing, capping services that people can receive. This is a great example of how a one-size-fits-all system doesn't actually fit anyone, especially people who have those medical conditions that are deemed to have been caused by individual choices, such as a bad habit, an exercise, or are really symptoms of an unfair system, such as living in a food desert or working several jobs that wear out your body very quickly. Not only that, the cost reduction is going to lead to eliminations of redundancies. How many hospitals does Minneapolis need? And if there aren't, different providers popping them up? Where should they be located? Do we really believe that the government's redundancies is going to close the hospitals in downtown before they close them in North Minneapolis? I sincerely doubt it. Either way, getting rid of these redundancies is going to increase travel and wait times while reducing the quality of care. A two-tier system has the advantage of a single-payer system without causing all these harms associated with it. A two-tier system will provide basic coverage that will take care of the medical alignments of 90% of citizens. What we are really arguing about is the remaining 10%. A one-size-fits-all system is not going to work for this 10%. But even if it did, it would explode the cost and destroy the access of quality. The option to buy into extra medical services in a two-tier system would increase competition, innovation, and encourage companies to create low prices in competition while being high quality. None of these would happen in a single-payer world. As said in the first speech, the barrier to inequitable healthcare is financial for only 20% of people. For the other 80%, things like transportation. A private system would resolve these barriers by being more flexible, and a public system would make these barriers a lot worse. At the end of this debate, I hope we've made it clear that the barriers are not what people think they might be. In light evidence and the facts are clear that a single-payer system is too restrictive, while a two-tier system is a perfect fit. Thank you, judges, so much, and this is why you should vote negative.
Thank you all so very much. That's been our debate here. And let's head on over now to the Q&A panel.